This is Ethan Moore, and I'm going to be demonstrating my circumcision care for the care of a newborn. So first you would walk in, perform hand hygiene, apply clean gloves, identify the patient by their armband, and then you would explain the procedure to the parents, and you'd also need to educate them on this because they're going to have to do it at home. It's part of their discharge planning. So first, it's the nurse's job to assess. So you would need to only uncover what you needed to uncover because we know that babies can't regulate their body temperature and they need to be as swallowed as they could. So the nurse would be assessing for the circumcision site for any bleeding, the cessation of urine, and especially monitor their urine after the first void after circumcision. So circumcision care is when you need to teach the parents that during circumcision care, during every diaper change, you would need to wash the circumcision area with warm water, and then they would need to assess for bleeding, and if there was any bleeding, they would need to gently apply sterile gauze pad until the bleeding stopped. But if it didn't stop, that they would need to report to the healthcare provider immediately. So after circumcision, normally the glands of the penis will form like this yellow granulated exudate. You would need to tell the parents not to wipe that away or pick it off because it would promote healing, but you do need to apply petroleum jelly to the circumcision site and to the granulated exudate to further promote healing. And you would need to tell the parents that when they're applying diapers that they would need to not apply it too tight because that would cause pain by compression. And you would also need to tell them not to apply it too loose because that could cause irritation by friction. So again, you're just washing the area with warm water at every diaper change, assessing for those things, and the nurse could administer Tylenol if for the management of pain if the healthcare provider ordered it. And for the Plastidy Bell method, the Plastidy Bell is attached to the glands of the penis and secured around the tip. So the Plastidy Bell itself will stay attached for 2 to 3 days. And if it doesn't fall off by itself in the 2 to 3 days, if it's still on after 8 days, you would need to go to the healthcare provider for him to remove it. And you would need to instruct the parents that applying petroleum jelly is not necessary for this method because it's already protected by the Plastidy Bell. And that's it.